Best early 2000s band or artist that you were always listening to?
Yeah. I think that's an easy one. I have to go with the Red Hot Chili Peppers. Love their music, the rock, the funk, hip hop.
Can you tell us about your research and why it is so important?
Yes. So I am a social epidemiologist, and social epidemiology is a branch of epidemiology which concentrates on the social determinants of health, social structures, and what I mean by that are policies, institutions, even social norms, and how those negatively impact population well-being. A lot of my field in epidemiology focuses on identifying risk factors for poor health, but my work goes beyond that to designing interventions. So for the past 15 years or even longer, I've been taking my science to the community to work with them to create effective interventions to improve well-being. And that's actually the focus of my Canada Research Chair, which is on population health intervention research. Lately, my research has focused on creating better housing options, especially for women. We know that there's a housing crisis now. Also, my work focuses on creating social policies that are more inclusive. I don't know if you knew that many of the policies and programs and interventions that we have center the needs of men. And so that means that the unique needs of women and gender non-binary individuals are not considered, and that can bring harm to those populations. So that's what I've been focusing my work on.
Okay. You first arrived at St. Michael's in 2004. What changes have you seen in research here since you first arrived?
Yeah. So I guess the one word that comes to mind is growth. I arrived in the early days of research at St. Mike's under the first VPRI, and it was early days for him too. And so we focused on growing. The MAP Center for Urban Health Solutions, which I directed at that time, was much smaller. We didn't even have this research building. We got the research building in 2011, and the rate of growth was so fast that by the time the building was completed, we had outgrown this research building. So one word is growth, but it isn't just more scientists or more research dollars. I think there's been growth in excellence. One representation of that is the number of Canada Research Chairs that we have. But I think another important distinguishing factor is the diversity of the research that happens here at Unity. Many hospitals focus just on basic science and clinical research. We focus on both of those, and in addition, we have community-based research and policy research, and I think that is a marker of excellence, the diversity of research that we have here.
What is it about Unity Health's research community that's kept you here for so long?
I think number one is the people, for sure. I am so fortunate to work with such amazing people every day, and that's been true for 20 years. But I think one thing that brings us together is that Unity is a values-based organization and lives its values, not only when it delivers care to patients in the hospital, but also in the research institute as well. I'm very proud that research leadership focuses not just on the scientists, but also on the trainees and the staff. After all, it's the staff, I think, who really make the principal investigators and the scientists look good. But, you know, there are fewer opportunities for staff to get recognized, to get awards, to get access to resources like travel to conferences. So I think the fact that research leadership prioritizes their well-being and tries to make sure that they're paid well is really aligned with the Unity values.
So as you switch gears and step down as executive director, what are your hopes for the future of the Li Ka-shing Knowledge Institute?
I am hoping that we can make more progress on the equity indicators for the workforce here in the Research Institute. I think we've done a lot, so don't get me wrong. We've certainly created equity committees, hired equity officers, and we have created programs for Indigenous and Black identifying trainees. But we have done some of the easier activities, requiring and providing education to our workforce. But I think we can do better. For example, I do think representation in leadership is an important component of equity that we really do need to make progress on. I think sometimes we hear phrases like, well, that's very hard. And it is, by the way. And or because it's hard, it's going to take a long time. But we learned from COVID that we can make significant and rapid changes to improve working conditions for the workforce and to keep them safe. And so we know that it's possible to make those kinds of changes. After all, these inequities that we care about, they were created and they're maintained by people. And so as people, we can work together and prioritize dismantling the status quo and making sure that we achieve